All right, everyone. Thank you for joining. Today, we're going to go over the fiscal year 23 solicitation for domestic violence shelters and sexual assault agencies. I'm going to begin with an explanation of our federal funding status. We recognize that this year the solicitation process is combining multiple fund sources, and that also for several years we've been talking about VOCA reductions. And so I kind of wanted to go over that with everybody to level set how we got to this meeting today. So most of the fund sources utilized by OCJP have remained relatively stable. Our Stop Violence Against Women grant, our Family Violence grant, our Sexual Assault Services Program grant, they have remained relatively stable. We also, very early this year, in fact, received funding under the American Rescue Plan. For those that have reviewed the solicitation packet in advance, and on the letter we sent out to everybody, you would note that people are receiving funds from this fund source. It was this fund source that caused the delay from December until very recently in releasing the solicitation, as we had to go back and rework the funding with this in mind. Now, unfortunately, as we've been discussing for several years, our Victims of Crime Act funding has seen sizable reductions. These reductions will have a tangible impact on agencies in FY23. That's not as reflected as in the grants of this audience, but some of our other victim service providers are seeing much different reductions than you all are because of the unavailability of the ARP funding. Claire? So this is a short history of our VOCA funding. In 2014, our agency had 9.2 million. This is pretty consistent for us over the years prior to that time, where we would have between $8 and $9 million. The way that VOCA worked previously is VOCA is primarily funded by federal fines and forfeitures. There was a statutory cap on the amount of money that could be released. And more money was going into that. You could essentially think of it as an account, then could statutorily be released every year. And so what they saw on the federal level was the amount of VOCA funds in the reserve was increasing and increasing and increasing. In order to mitigate that increase, a decision was made to change or lift the cap on the funding, and this has resulted in states, including Tennessee, receiving dramatic increases of funding over the next few years. You can see we went from 2014, 9.2 million, all the way up to 39.7 million, a 330% increase. Quite a shock to our agency administratively. Prior to 2015, we really only had about 3 or 4 program managers focused on VOCA, and now I think all of our 16 program managers touch it in some way. 2016, we saw an additional increase. 2017, it decreased, but only slightly. And then in 2018, we received another major increase. You'll note on the slide it says "We are here." So OCJP is about 3 years behind in spending its VOCA grants. We've always been this way. This allows us to adequately plan for the amounts of funding that is coming up. And also the federal grants are only available for about 3 years. So what we typically do is we'll receive an award, we'll spend on it for 2 or 3 years, and then we move to the next award. So probably around 2020, is when we started messaging to agencies that we were seeing kind of a dramatic decrease in the amount of VOCA that was going to be available in future years. And you'll see in the 2019 award, there was a 32% increase. In 2020, there was a 25% increase. And in 2021, there was a 34% decrease rather. So these decreases is what lies before us at this time, because we are still in VOCA 2018. And so, in fact, we had predicted that the reductions would be so severe that many of the agencies on this call got reductions for this fiscal year that we wound up actually amending and erasing last year. Now, the question comes, where did we find the funding to amend and replace that funding and raise the funding? It's a good question. So it's really COVID is to blame, as it is to blame for many things. But in this case, what happened was when COVID hits, there was kind of a major disruption in victim services across the states. And so agencies that normally had a kind of a track of spending that was regular and predictable really slowed services for a number of months. This caused a lot of the 2018 funding that had been obligated to roll back to us when the fiscal year ended, and that allowed us to re-up the funding and increase everyone into this year. But we're really at the situation now where VOCA 2018, we've gotten as many extensions as we can. And in fact, we've obligated all of the funds. And so we're actually in the process of transitioning to VOCA 2019. And so that is how we've got to the solicitation process today, where people's grants are made up of kind of a multitude of different funds. We're using those other fund sources that do similar kind of allowable activities that align with VOCA to supplement and kind of negate some of the decrease that's coming. Claire? So, we knew this was coming for several years, and we've only got so many years to spend our federal grants. And so one of the things that we tried to do was really mitigate the impact of the upcoming decrease, despite the increase of the VOCA 2018 funding, by initiating programs that were short-term. We did training programs, which was a little difficult under COVID. We migrated a lot of the trainings to virtual statuses. We did a number of equipment grants. We did several one-year pilots. We initiated programs that were set to end naturally at the end of this year, so that those programs would not then need funding when we went to the reduced VOCA funds, which is what we're doing next year. As I stated, we can leverage additional fund sources through STOP SAS, FIPSFA, and ARP, which is what we've done with you all's grants. There is a little bit of hope on the horizon, though. The feds did pass the VOCA fix. A piece of this fix was a nationwide match waiver for agencies under VOCA until 1 year after the pandemic is declared at an end. And so your contracts should not have match until that date is reached. The pandemic has not been declared as over yet. So we're really thinking that probably for the duration of the 3 years, your agencies won't have match under these contracts. The legislation also supposedly changed the way that fines and fees are forfeited to VOCA. And so the decreases in fines and forfeitures that occurred that caused VOCA to reduce has hopefully been fixed on a legislative level. Now, it's all dependent upon cases and the fines and the forfeitures. So we really don't know going forward what impact the fix will have in terms of what level it will bring it back up to. But we are anticipating hopefully slow increases over the near future. Claire? So unfortunately, and I'll just be realistic here, is that everyone's seen kind of over the next 3 to 4 years VOCA getting lower and lower. And so our funding outlook for fiscal year 26, not knowing anything about what's coming in the futures, we're looking at between a 20 to 30% reduction to your agencies. And this is primarily because the ARP funding that we've received will not be available in FY26. So we will not have the benefit of that fund source to blend in. And then if you reflect back a couple of slides ago, the VOCA funding continues to decrease year over year. Now, that said, we will make every effort to recover unspent funds and try to blend them back into grants wherever possible, but we can only do projections based upon the funding that we have today. And it is at this point looking like a 20 to 30% reduction. So I think that in formulating your funding for future years, you have to be cognizant of that fact. And do some pre-planning there. I know that's a rough discussion for everybody, particularly with your boards, but we want to be as transparent and forthcoming as possible so that it's not a surprise for anyone. Next slide. And now, Trish, will you go over our fund sources?
Sure will. So
actually, sorry. Can we take questions from the last section?
Yes, sorry.
There was a question in the box. Sorry. There was a question regarding rising inflation and salaries to compete with workforce shortage. So is there any plans that OCJP has to maybe assist agencies in offsetting or lessening the decreases that are proposed.
Yeah, and so our plans have been to blend the various fund sources that apply to the programs that we fund kind of in perpetuity year over year. So the blending of VOCA and STOP and SASP and family violence and ARP is our way to mitigate those reductions over the next 3 years. Unfortunately, we don't, other than what's been expressed in your letter, we don't on the immediate horizon know of any more funds that are going to be made available to us. So it doesn't necessarily help your bottom line, but of course, in terms of pay and retention, you are welcome to use the funds that you have been provided to provide what increases you can. In fact, the ARP funds are specifically designed to provide for some hazard pay, some health and organizational wellness. But there is not additional funding that appears to be available at this time. We've blended everything we've got to this point for this solicitation. Katie, were there any others?
No, that was it. Thank you.
Thank you.
All right, so for fund sources, just like Jeremiah has mentioned, we're going to be blending those sources as much as possible to mitigate and minimize the impact of those reductions. You all should have received a letter that has the fund sources and funding amounts. So if you haven't received that letter, talk with your program manager. And if you have any questions, like Jeremiah said at the very beginning, you'll have an opportunity to work with them through those questions. So DV agencies should get a combination of VOCA or STOP, FIPSA, and DV ARP. SA agencies, VOCA, STOP, or SASP, and SA ARP. Next slide. We'll go through some of those. So VOCA. Most of you have received VOCA in some form throughout the years, so you're more well versed in this. But just to go over a little bit, this is funding to directly improve health and well-being of victims of crime, and so those responses to emotional and physical needs, primary and secondary victims, and then participating in the criminal justice system. So, like I said, this is stuff that you all probably know pretty well. So I'm not going to dwell on that one too much. So let's move to the next one. So this is STOP. Some of you all will be receiving STOP for the first time. So we'll go into this one a little bit more. So this is funding for projects that assist organizations in efforts to reduce violence against women focused on DV, SA, and stalking. The big thing with this one is that for dating violence, stalking, and sexual assault, you can't serve individuals under 11. So keep that in mind. And then DV victims and children can be served regardless of age. So that's the little nuance in STOP where you have to be mindful. And, we're going to get into this a little bit later, but when you're thinking about your different fund sources, it's going to be important to remember those differences, because then you can put things on specific fund sources since you have that blend. Next
Can I
slide.
just say one thing about that
Yeah.
last slide? So that piece of STOP where it talks, can you go back one slide where it talks about the DV? Yeah. So an example of that is like if you've got a mom in shelter and there's a child there that's 5, 6 years old, that child can work with a child advocate. So the primary victim has to be over 11. So, 12 or older. So I just wanted to, because that can be very confusing if you've never had STOP money. So we're not going to throw STOP money in a child advocacy center. So that's kind of the difference there.
Awesome. Thank you.
Yeah.
Okay, so SASP, Sexual Assault Services Program, that is directly related to victims of sexual assault. And the purpose of SASP is intervention, advocacy, and accompaniment. So that's accompanying victims to court, medical facilities, police departments, things like that, support services, assistance for adult, youth, child victims of sexual assault, and family members affected by the sexual assault. So this one is very sexual assault specific. If you've received SASP before, you know some of the nuances, but we'll get into those later as well. So FIPSA is preventing incidents of family violence, DV, and dating violence. So that's immediate shelter support services, community-based programs for family violence, domestic violence, or dating violence, as well as dependents. So shelter programs have those 9 core components, which if you are a shelter program, you are meeting those 9 core components because we're funding you. So safe and confidential shelter, your 24-hour hotline, counseling, advocacy, transportation, community education, referrals in the community, follow-up services, and children and underserved populations. So those are our the FIPSA stuff. You can't do transitional housing in FIPSA. So that's your big no in that one. So these are the new ones, the American Rescue Plan. We have split them into DV and SA to make it a little bit easier. So with the domestic violence, ARP, it's focusing on COVID-19 testing, access to vaccines, and mobile health unit access. And then you have personnel expenses for those programs, as well as continuity of DV services. So this is where you can put some of those hazard pay increases, things like that. And there are some things to consider around that. So with DV ARP, some of the questions you can ask to figure out what to put in this fund source. How can you eliminate barriers to testing? Could you bring folks in to do tests? Can you buy test kits? Can you have them on hand? That kind of thing. Encouraging and coordinating vaccinations. Do you have a teaching hospital next to you that you could have nurses come in and provide vaccinations, that kind of thing? And then mobile health units there's a specific definition for mobile health units, and you can see that in the OCJP grants manual. But really, mobile health units is partnering with your hospitals and having them come out to do wellness checks. It's a little more general health and wellness, those things that you've neglected during COVID. So have you gone and gotten your general shots, not just COVID shots, that kind of thing. And then how can you partner with your local health departments to provide screening and then all those other health things? So you've got the mobile health units that can come out and provide some of that, and then partnership with local health departments to get folks out there and get their health screenings taken care of. Like I said, the OCJP grants manual has some allowables and unallowables and more information about the DV ARP fund source. And this will have a link. The presentation will have a link to it.
Trish, can I jump in real quick?
Yes.
So I know everyone's reading the DV ARP allowabilities and also the SA ARP allowabilities on the next slide. So these are priorities for the funding, right? And our scope of services for these funds does want agencies to speak to how they're considering and working through health advocacy issues. However, the intent of the fund source itself is to prevent, prepare for, or respond to COVID-19. Initially, the coronavirus funding or American relief funding that we've gotten last year, the definitions of prevent, prepare, and respond were much narrower, having to do with specifically like COVID-19 related issues, which is kind of what's bulleted there, right? Well, the definition of respond has been expanded, and an appropriate response is whatever activities your agency needs to conduct in order to maintain services during a global pandemic. And so what that could mean is anything that's allowable under the fund source, and we'll go over all of those here in a few minutes, that you need to pay for in order to provide services with your agency. So our scope of services does want you to consider and speak to the bullets that Trish went over, but that does not have to be the totality of the things that you fund. You can fund the routine things you're doing day to day, because that's what it's going to take to continue to function during a global pandemic. And this advice applies for DV ARP and SA ARP on the next slide.
Yep. Yeah, and when you talk about like COVID vaccine, COVID testing, and all of that, if you have those things in place, those can also help you stay open and serving clients in shelter as well. So, building all that in, how do you stay open completely and provide services to folks? So let's go to the SA ARP. So this one is obviously sexual assault. This one is a lot wider than the previous DV one because it is written to ensure SA services continue despite the challenges of the COVID-19 pandemic. So it really talks a lot about virtual services. It talks a lot about assessment of survivor needs and how COVID has changed those needs for survivors and for agencies as well. So looking at operational capacity. And so that goes to that question asked earlier, you know, how do we kind of mitigate pay differences now? And so this is one area where you can plug some of that stuff in. Training for staff on health and well-being, and then building agencies' capacity to just keep going. So how do you deal with kind of the current climate that we're in for hiring, for providing sexual assault services in a global pandemic? So again, this is in the OCJP grants manual. There's a link off this page to the SA ARP fund source. And just to kind of reiterate what we've said, these are new, and your program managers will help you kind of navigate this as you go through. Next slide.
Thanks, Trish. Katie, do we have
yeah,
any questions?
We do. We have 3 questions in the chat box. So I'll just start with the very first one. The first one is, for agencies providing both DV and SA services, can staff work with both populations and have salaries and or benefits cost allocated to both programs?
Let us take that question and respond, and maybe get in touch with Paula. I just want to make sure that I clearly understand what she's saying. So generally speaking, if you had a single advocate that was providing DV and SA services, you're going to wind up with, you know, potentially like 6, like up to 10 different grants under this. You could split them with part of their time on DV, on your DV grant, and part of their time on the SA, or even across the multiple little DV and SA fund sources. So I believe the answer to that is yes, but we'll get with you, make sure that that was your question, and get further guidance.
Great. The next question, I believe, will also be kind of a similar answer from you, Jeremiah, in the sense that we will have to review and get back with the individual. But Ryan asked if services described in the fiscal 1 ARP description from ACF is allowed. He also included the link for that. So I would assume that our office needs to review that before we can answer that question.
That's correct. Thank you.
So we will get back with you, Ryan, on that one. Rachel asked, in previous grant cycles, we could not have employees on more than one fund source, but now we're getting our funding levels from various funding streams. So can employees have multiple fund sources as long as they're not crossing DV and or SA streams? So similar to kind of what you were just talking about.
Yes, they can be put on multiple fund sources. Now we're going to talk about some ways, particularly under ARP rather, that you could have a wellness advocate that you could put totally on the ARP funding, and that would mitigate kind of having to I guess a lot of the administrative work and having to track people across multiple fund sources. But yes, you can split people across the fund sources if you want to. I think there's an administrative benefit when you're looking at DV to trying to put as much people's time as possible on a specific grant, so you're not carving, you know, hours across multiple things. But you can split them, yes.
Great, that was all the questions.
All right, now to allowable activities. So in order to help agencies understand the various fund sources, and I recognize that this may be a little hard to read, we have gone through typical costs that are associated with DV and SA grants and listed the fund sources, and then provided kind of yes or no whether or not those activities would be allowable, or those costs would be allowable under the grant, and if there's any caveats to that. What I'm going to do now, this is the portion I referenced earlier, is I have the next few slides have these activities listed. I'm going to touch on them very briefly without the intent of reading every individual slide. This is primarily to provide you with some information when we send the slides out to take back to your place of business and be able to kind of marry up how all the fund sources can connect. And I'll also speak to some places where you can kind of leverage the funds in ways that may not be immediately clear. Next slide. So the first is personnel costs. Personnel costs are directly related to providing direct services and supporting activities. This is allowable under all of our fund sources. Obviously, you must prorate staff based upon the number of fund sources in your agency. This is something that you've done routinely anyway, so you will need a cost allocation plan for staff. Now, the caveat to this is that ARP can pay for 100% of a wellness advocate, and that does not need to be prorated across all of your fund sources. So let's talk about a wellness advocate for a moment. Trish spoke briefly moments ago kind of about the wellness activities allowable under the ARP. A wellness advocate would be an individual who's really working with your clientele to determine that their health and wellness needs are met. It can and likely will involve COVID and COVID vaccinations and COVID testing, but also can involve just more general health and wellness activities. If you have partners with local medical providers, this can be someone who makes sure that maybe you've got a client who hasn't been to the doctor in 3 years or has kind of a habitual issue that needs to be addressed. This can be the individual who works with them to kind of get them in, to refer them to the treatment sources that they needed. And obviously an important part of health and wellness is working with the underlying trauma and victimization that occurred to get them into your services anyway. And so this wellness advocate, though they definitely have to do the health and wellness activities I described, the normal trauma and victimization work is also a piece of that. So they're not barred from performing that work. And so one way I could envision this is if you wanted to put a wellness advocate on your ARP application, maybe this is an individual who has a somewhat reduced caseload compared to your standard advocates, because they'll be totally responsible for the health and wellness piece, but they would do kind of routine case management for the people assigned to them also. Skills training for staff. Training exclusively for developing the skills of direct service providers, including paid staff and volunteers, so that they are better able to offer quality direct services. This is allowable under all of our fund sources, but must be prorated. Next slide, Claire. Training related travel. Travel is allowable under all of the fund sources. It needs to be appropriately prorated. Organizational expenses. Organizational expenses are necessary and essential to providing direct services and other allowable victim services. Is including but not limited to rent, utilities, minor building adaptations to meet ADA requirements. This is allowable under all of our fund sources, but must be prorated. Claire? Equipment, I realize that this, because of the number of words on the slide, it shrank down. I think everybody's generally familiar with what equipment means. It is allowable under all of our fund sources and must be prorated, except if the equipment is solely for the benefit of the victim. So this does not include items staff use for the benefit of the victims, then it can go 100% to VOCA. So if part of your grant is purchasing equipment that is going to be solely used by the victim, I think my recommendation would be to consider putting it 100% on your VOCA grant, so that you don't have the administrative of cutting up a piece of furniture potentially. And that would be my example, right? Something solely for the use of the victim could be furniture in a victim's room in an emergency shelter. Now, the ARP funding can go 100% towards equipment used solely to prevent, prepare for, or respond to COVID-19. This could include PPE, testing kits, or other related expenses. If you have something that is clearly only going to be used with a COVID-19 nexus, it could be put 100% on ARP without prorating. Next slide. Operating costs, including but not limited to, and there's kind of a list of services there: supplies, printing, photocopying, courier services. Just kind of the hodgepodge of of expenses that an agency has that's allowable under all of our fund sources and needs to be prorated. Specific assistance, so that includes the relocation of a victim when necessary for the safety and well-being of a victim, including but not limited to reasonable moving expenses, security deposits on housing, rental expenses, utility startups, emergency food, clothing, and similar needs. This is allowable under all of our fund sources, but does not necessarily need to be prorated. And so if you're looking at putting specific assistance into your budget, you don't need to cut it up so that it's in little bitty pieces across all of the fund sources. You're welcome to do so if you want, but it's perfectly appropriate to have an individual that's maybe being primarily served by someone who is funded on, let's say, VOCA and family violence, but all your specific assistance is in your VOCA grant. That's fine. You can still pay for 100% of the specific assistance out of your VOCA grant for them. So specific assistance, if possible, I think my tip would be to try to put it all into one of the grants. Next slide. Supervision of direct services. So the payment of salaries and expenses of supervisory staff in a project for time spent supervising individuals providing direct services. So a lot of our agencies have supervisors and even director level individuals who are on there just like smaller pieces of their time, which is representative of the time they spend supervising the direct service individuals. This is allowable under all of our grants, but must be prorated. Public awareness and education presentations. And this includes online and digital ads. I know a lot of people no longer use newspaper notices and have moved to online formats. This would cover this. The key is that it's really designed to inform victims of specific rights and services and provide them or refer them to services for assistance. So the awareness that you do kind of to provide the community with information on your organization and help people identify their victimization, that's allowable under all of our fund sources except for SASP and must be prorated. SASP is really geared towards meeting the immediate kind of traumatic victimization needs, and so it does not fund public awareness. Next slide. Administrative costs, this is the cost associated with doing payroll, reporting, all of the things that your agency does kind of in conjunction to administratively managing the grant. That's allowable on all of our grants. After the grant's been awarded, we cannot pay for preparation costs and must be prorated. Forensic evidence collection exams, forensic medical evidence collection examinations for victims to the extent that other fund sources such as state appropriations are insufficient. For agencies that deal with the forensic evidence collection exams, you're probably aware that Treasury does have money available for reimbursement. So where that money does not cover the costs, it can be built into your grant. It would be allowable, obviously, only for our sexual assault agencies, but is allowable under STOP, VOCA, and SA-ARP. Prevention includes both primary and secondary prevention efforts. Prevention means strategies, programming, and activities to stop both first-time perpetration and first-time victimization. Primary prevention is stopping crimes before they occur. So this is allowable under STOP, FIPSFA, and ARP, but there's a pretty big caveat to this, is that you can't allocate more than 5% of your grant to providing prevention services, and that's 5% of the individual fund source grant that you're receiving, not kind of the totality of the funding that you're getting. So if you were getting a family violence grant for $30,000, you couldn't do more than 5% of that towards prevention. So it's not going to wind up probably being a lot of money available for that service for most grants, but it is allowable. Management expenses, salaries, benefits, fees, furniture, equipment, and other expenses of executive directors, board members, and other administrators, except where specifically allowed elsewhere, is allowable under FIPSFA and ARP and must be prorated. So that's a big difference to a lot of your agencies, because that is not something that VOCA allows, and most of you have received VOCA funding. You can put general management expenses on your FIPSFA and ARP grants. Transitional housing, housing whose purpose is to facilitate the movement of individuals and families experiencing family violence to permanent safe housing, is allowable under VOCA and STOP, must be prorated. Now, let me pause here and give our first pitch for our transitional housing solicitation. We do have a solicitation up on our website now, specifically geared towards transitional housing. And so if that's a currently existing program that was funded under previous grants with our agency that are ending, I think one thing you might consider is applying for that grant rather than building it into these grants. But certainly if it's something that you want to protect, because the transitional housing solicitation is frankly competitive, then you are welcome to build it into these grants, and it is allowable under VOCA and STOP. Next slide. Of course, fundraising and lobbying are not allowed under any of our grants, and are defined as fundraising, any activity related to fundraising. This includes asking for donations, hosting events, writing grants for funding, lobbying or advocacy activities with respect to legislation or administrative changes to regulations or administrative policy, whether conducted directly or indirectly. And I know everyone knows that lobbying and fundraising is unallowable, but I want to emphasize them because a slide or so back, we said that like ED salaries, board member costs could be applied to the grant. Obviously not those costs that would be associated with fundraising and lobbying. And, you know, I think there's probably a considerable portion of their work that somehow dovetails into these two activities. So make sure if you're putting those individuals on the allowable grants that you leave enough percentage of time for them to liberally engage in fundraising and lobbying as appropriate to your agency. You know, I think with these positions, we advise for advocates. You know, we typically, if they're going to be involved in fundraising, don't want to see people on our grants more than about 90%. I don't have a specific percentage for an executive director, but I would imagine it would need to be substantially less. Next slide. And now, Katie, what questions do we have?
Yes. So we have two questions that came up. So the first one is regarding the wellness advocate that you spoke of at the beginning. So can that wellness advocate also include assistance with mental health needs?
Yes.
Okay, easy. The next question is in regard to proration. Would OCJP be able to provide agencies with a formula for proration? And are we saying that these costs must be prorated across all of the combined new funding sources, or can something be prorated between two sources instead of all sources?
So let's take that back and get our fiscal team to answer. Off the cuff, it would need to be prorated between allowable fund sources for the specific activity. But let's take the totality of that question back and get fiscal to give us a good response. And if necessary, we can certainly pull together some sort of fiscal presentation for the group.
Thank you. That's all the questions.
All right, Laura, would you like to speak to our application process?
Sure. So the narrative or scope of service or logic model or attachment A, whichever you want to call it, is going to be the first section of your application after you review the solicitation and determine what activities and staff you would like to have on each fund source. And so I wanted to take a minute to review the scope of service. I intentionally did not do a screenshot, and I'm not sharing my screen for the scope of service because the domestic violence, sexual assault, and FJC Partners they're all slightly different, and so I didn't want to just use one as an example. But I feel like these tips you can use across all of the narratives, and I'm just going to call it a narrative just to be easy. The intent to apply, though, this question has come up quite a bit. You only need to do one intent to apply for each grant. So if you got a letter for Family Justice Center Partners, sexual assault, and domestic violence, you would just do one intent to apply for each of those. The intent to apply is going to ask you for a fund source. Just pick one. because of the way these are structured, we know what your fund source is. And so when you go to do the intent to apply, you're going to have an option of about 10 different fund sources to choose from. Choose VOCA if you want, if that's what you feel comfortable with. But many of you have noted that ARP is not listed, and that's okay. Just pick a drop down for domestic violence, then do one for sexual assault, then do one for Family Justice Center Partners. And don't worry about the fund source. And then the rest of it you should be able to fill out the rest of it on your own. So in this narrative, you will see that it is multiple pages, anywhere from 10 to 12 pages, and it seems like a lot. However, what we've been able to do is take some of our old narratives and break them out into individual questions so that we can get better answers. But to go along with that, because we've asked pretty specific questions, we're looking for very specific answers. So be succinct. For example, in the problem and needs statement, we don't need the history of the organization. We are simply just asking for the needs and problems as you see it or as it exists in your community. You do not have to give incredibly long answers for these questions. And something I like to think about in the back of my head is, as you're going through your narrative, if there is a point where you have to say, as previously stated, maybe think about what that question is asking, or maybe think about what that previous question is asking, where you feel like you've had to be repetitive. So in the problems and needs section, then just basically ask and answer. So again, we're not looking for the history and so much information. We are looking for local data. We are looking for problems as it relates to your specific community. The next section is goals, objectives, and activities. These should be related to your organization's success. We did not provide goals and objectives as we've done in the past. We're leaving that up to you. Domestic violence narratives, you should use the DV abstract that's linked. It's on page 4 of the solicitation. You can use those for your goals and objectives. If you are a sexual assault program, or if you are a dual program, your sexual assault, you may want to look at those domestic violence or that domestic violence abstract just to maybe get some ideas. If you are a standalone sexual assault program and you would like to see that DV abstract, you can ask your program manager and we will gladly share that with you. If you are just looking for some ideas about how to word a goal or an objective there. The output section is highlighted. For sexual assault, those are sexual assault related outputs. For domestic violence, they are domestic violence related outputs. Those are the ones that we would like for you to use. If you feel like there are some other types of victimizations in the outputs that would apply to you, talk to your program manager about that. But again, we are looking for the primary victimization. So for example, if you are a domestic violence program and you have a client who comes to you because their partner has financially exploited them, they would be a domestic violence client. They would not be a financial exploitation client. A financial exploitation client typically falls in the realm of elder abuse. So same thing with sexual assault. If you have a client who is sexual assault, but through the process of that intake, you realize that their car has been stolen, they still have come to you as a result of sexual assault. There may be other types of victimizations, and if there are secondary victimizations, you can certainly work with that client on those. But we are looking for primarily, why did that person come to your organization? And so that's why we've highlighted domestic violence, stalking, harassment, and sexual assault in adults, abused as children. Also in the narrative, you'll see a link to definitions. You can read those definitions and you can see how the other types of victimizations are defined. So I know in the past, some of you, for example, have used bullying. Well, bullying is only used for children. For adults, that would be harassment. And so, like I said, we've highlighted those that are relevant to your specific solicitations, and we would really like for you to use those unless there's a reason that you feel like something else needs to be added. By all means, talk to us, and we're all ears to help. So the services after the initial numbers of the victimizations, there are multiple services that are listed. Those services that are listed are services that you would provide under these fund sources. We do not expect, nor do we want you to have numbers in every single one of those categories. We understand that while you are great at what you do, you are not Superman or Superwoman, and you cannot be everything to every person. What we would like for you to do is pick what you're good at and do it. Those are the numbers that we want to see. So, for example, I'll use transportation. If transportation, for whatever reason, is not something that you regularly provide, let's say out of 400 clients a year, you've only had to transport 2, I would not list that as a service, even though if you're domestic violence, that is a service you have to provide. So I was using that as an example. So if there's something that you very minimally do, it's probably not worth your time to track to report back to us. So things that we would expect you to see for domestic violence: assistance with landlords, creditors, transportation is one that would be helpful. I already said personal advocacy, assistance with the criminal justice system. If you're sexual assault, forensic exams or accompaniment to medical exams or the hospital. But if you can look at your past quarterly reports for VOCA, and if you've not received VOCA, if you look at your past annual reports and you see that there is something that you really don't do very often, it might not be worth tracking that. The link there is also available for you to look at the definitions of what those services are. It could be that you may have misinterpreted what a service is and maybe have been counting it wrong or something. So I just encourage you to look at those definitions and determine what is the best fit for your organization, for your community, and for your clients. If you have numbers in every single one of those categories, it's possible that we may ask you to be realistic about what you can accomplish and think about how that relates to the different fund sources as well. So if you have, let's say 30% on VOCA, your VOCA narrative is only going to represent 30% of those numbers. And it might be that that particular 30% may not hit every single fund. Every single service. So each output section will be reflective of the fund source. One thing that I did forget to say back up in the problems and needs, these are very robust, but as Jeremiah has said, there is an opportunity to copy and paste quite a bit. So in the problems and needs section, if you are applying under domestic violence, it doesn't matter your fund source, you're still going to have the same problem of domestic violence. The same thing with your goals and objectives. A lot of those can stay the same. Your activities may be different depending on your fund source and depending on what's allowable and unallowable. Your outcomes and your outputs, those are probably going to be very much the same, with the exception of maybe some numbers might be a little bit different, depending on what percentage you have staff or personnel, staff or professional fees, what percentage they are on these grants. Those numbers may need to be adjusted quite a bit. So services, as it's here on the screen, services should be thoughtful and meaningful. Going back to, think about what you do well, and then provide those services. The required outcomes are listed as they are every year. Be sure to delete the ones that you are not using. If you don't delete the ones that you're not using, we will assume that you're going to be asking all those questions. And for monitoring, we will look for a survey that does have all of those questions on there. The input section, we are looking for some very concrete yet succinct answers. So for example, the question is, how do you know your clients are receiving trauma-informed services? Your answer should not be, we are providing trauma-informed services because it's our policy. We want to know how you are providing those services, and how do you know that your clients are receiving those? So you may have peer review. You may have policies, but how do you know those policies are being implemented? Do you provide performance evaluations to your staff that can relate back to implementing your trauma-informed policies? So think about how do you know this is actually happening, instead of just saying, this is what we do. Let's see, I have a note here that says, for example, are there policies in place that are evaluated either by board or staff through performance? Is there peer review? How do you know that what you're doing is trauma informed? The same thing with how you educate clients on trauma and ACEs. We're looking for more than, you can't just say that you're doing it. We want a little more information there. Outreach, describe your outreach activities. How do you know that they're meaningful? You can go to, for example, you can go to a community fair and you are just handing out brochures, but are you having conversations with anyone? What kind of evaluation do you do based on, if you go to an event, maybe do you have an increase in your hotline calls after that event? So think about meaningful outreach to your community. And then another section in the inputs is fairly new. For those of you who may have done some equipment grants with us, this section was listed, and it is a brief statement about your budget. So how did you determine this number in your budget? So for example, you may have $15,000 in supplies. How did you come up with $15,000? Is that based on past spending? Do you allocate X number of dollars per staff member for supplies? Is it determined some other way? Do you have a cost allocation plan that might outline where that number came from? And so this section is also helpful to you to help you maybe understand what fund sources different things may be on, depending on how your spending has been. So we're just looking for just a brief statement about how you came to that number.
Laura, can I add something to that?
Absolutely.
So in terms of this specific section, we're also looking for how the specific budget item will be used by the program for the, over the life of it. And so I'll just, candidly say what we see sometimes is an agency will ask for, let's say, 7 computers, but then you read their scope of services and it does not say anything about who those computers are for, what the computers are supposed to do. And that's what begins the back and forth between OCJP and your agency, trying to figure out like what the need is and what the specific items for. The way that the scope with this budget section is designed is really for you to say, I need 7 computers. These computers are for our advocates. The computers they currently have are 5 years old. They need these and able to do like X, Y, and Z, like words or a couple of words activities, and then you can move on to the next category. We just want to make sure that through all the levels that your application goes through, that any budget questions that arise can mostly be answered by looking at your narrative, and there's nothing on the budget that's not some way specifically referenced in the budget. It'll help our review, and it'll drastically, hopefully, cut down on the back and forth after you turn in these applications.
And then additionally, to add to that, there are instances where, as a program manager, either my supervisor or those higher up will come to me and ask me a question about why are there 7 computers? So if as a program manager, if I don't readily know, or if there has been a change in program managers, it's very helpful to have that information so that we can advocate for you and support you as we need to. So I'll move on to the collaboration section. Collaboration is very similar to how it has been in the past. We are looking for actual collaboration, not just a list of names. Keep in mind, collaboration is mutually beneficial. So think about how these services are helping your clients, and then what you're able to do for that organization, kind of in return. That any MOUs should be current, and I would say current within the past year. An MOU from 2015 is not relevant, and we would ask you for a new MOU. There is a question about the CCR. Not all communities have a CCR. If your community does not have a CCR, talk about how you're involved with your SART and or DART. If you have a CCR and also have a SART team or DART, incorporate those in there as well. Again, this is one of those sections that can be copied and pasted across all of your narratives as well. Data collection is also a section that can be copied and pasted. Data collection is the same regardless of your fund source. And again, here we are looking for just very brief answers. For example, question number 1 is about who does your data. It can be, we prefer not to have names listed. Titles is great. So questions 1 and 2 can literally be 1 or 2 words. Who's in charge of your data? Our executive director, or our data manager. For some of these smaller organizations, one of our advocates is responsible for our data. It's just super simple. What kind of database do you use? You don't need to describe the database. If you use CAP 60, use CAP 60. If you use pencil and paper, say pencil and paper. There's nothing wrong with that. But across fund sources, this is going to stay the same. The final section in this is something new. It's a summary, and it's really, we're looking for a synopsis of what you're asking for. And this is beneficial because there are times when, again, as a program manager, I'm often asked, what is this project doing? And so I have to go through the narrative and try to piece together some things. But what we're looking for is just a good paragraph summarizing what you need. It says 200 to 300 words. That is not a hard and fast rule. Do not worry about getting your word counter out to make sure there are 200 to 300 words. If you go, a little under that, a little over that, it's fine. It shouldn't exceed half a page, which is more than enough for what we're looking for. And as we go through these, if for some reason we need a little bit more detail, we will always ask you for that. So it is not, it's not a problem. We're just looking for just a brief summary of what you need. So that was a lot of talking on that part. Claire, do you mind going to the next slide and then I'll ask for questions?
Laura, do you mind if I give you a break for just a second?
No, absolutely.
Claire, will you back up a slide for me? Yeah, so Laura did an incredibly good job both in this presentation and in designing the scope of services. I just wanted to bring specific emphasis to a few things. This scope is really designed to be answers to questions. So hopefully the amount of generating prose from nothing should be very minimal for this application. And we do really encourage y'all to copy and paste sections where the information is the same. And that could even be goals and objectives. It could even be some activities if you're just splitting the same activities across multiple grants. We really want this to be as easy as possible, but also accurate, which is why the summary section that Laura mentioned is really the only section that's specifically kind of where you draw in your own narrative. Everything else is kind of a long answer to a question, and we really hope that that's beneficial. And we do absolutely want to encourage people to copy and paste things where it's beneficial to minimize the amount of work on these. Thank you.
Thank you. Thank you. Thank you. Thank you for emphasizing copy and paste. It is your friend, as long as you copy and paste in the right section. If you're like me, sometimes you copy and paste into the wrong section. And anyway, so next slide, please. So your narrative, the output section of your narrative is going to coincide with reporting. Your VOCA quarterly report is going to prorate numbers based on the staff that you have on that particular grant. So again, going back to, you have somebody 30%, you're only going to report 30% on your VOCA quarterly report. STOP, SASP, and ARP are all going to be, those are going to be annual reports. You're also going to prorate those. Your annual sexual assault report, your annual domestic violence report, those are going to be all of your clients regardless of fund source. And for right now, our recommendation on ARP is to keep those prorated. Jeremiah, do you want to talk about ARP for just a second, about what you know about reporting for ARP?
Yeah, candidly, we do not have any concrete information on ARP reporting at the moment. We've been awarded the funds and had several meetings related to reporting, but not been given any concrete guidance. I do anticipate that at some point we will get concrete guidance and we will communicate that. So for now, I would save the numbers that you're already prorating for the other fund sources and just include ARP, and we will let you know what needs to be reported and when. And the reason why I recommend that, and again, I'll just be candid, is with the CESF grants, which was other coronavirus stimulus grants where we did not have concrete plans, a reporting period came about and the feds said we need this information reported in the next 10 days. And we had not been given reporting measures prior to that. And so that was quite the scramble for us and for our subrecipients to collect that information. So I'm strongly recommending you go ahead and prorate out your ARP numbers so that if the reporting is such that we need all of that, it's readily available. Because again, we have no control over kind of what justice mandates in terms of reporting requirements.
And it could be that you won't need those numbers, but if you do, you will have those. And so I've given an example here. You have a therapist who is 30% on VOCA. You're going to report 30% of their clients. But then at the end of the year, when you do your annual report for either domestic violence or sexual assault, you're going to report that as counseling number of adults and then that total number. So are there any questions?
There is one question from the very beginning of your part here regarding the intent to apply. So just for clarity for the group, is there one intent to apply for each fund source or one for all?
Yeah, so it's going to be one intent to apply for the entire solicitation, and I'll just pull back the curtain on the intent to apply. These days with our office, it's much less like you telling us that you're intending to apply as giving us the basic information we need to load your agency's profile into our database. So if you give it to us one time, complete and accurate, we can upload it and then replicate it and change the fund sources. And so we really only need one. I know it's kind of a pain to sit down and fill out the same form in triplicate. So one intent will do.
Correct.
Great, that's it.
All right, now we're going to go over, since we released the solicitation, we have gotten some questions already, and we're going to touch on those very briefly. Can I work with anyone at OCJP on my application is a question that we've gotten. And as previously stated, yes, we absolutely encourage that. Your program manager is available to answer any questions that you have. However, we will not pre-review a complete application. We sometimes get people who say, I finished, do you mind reading it and giving any feedback? We don't have the capacity for that. So we're happy to answer questions, but we won't do a pre-review. Other question is, the funding amounts that I've been provided, can we spread those funding amounts over the 3 years? And the answer is no, because of the way the awards begin and end. The letter explains the funding amounts that will be allowed for each fiscal year. We cannot roll money over year to year. Another question is related to why the fund sources changed. We've already discussed that a little bit. Funding was allocated to allow for minimal disruption due to the decrease of VOCA federal funding. So had we just funded everyone out of VOCA, we would be looking at somewhere between probably a 30 and 50% increase. So being able to blend the other fund sources and utilize ARP, which was a pleasant surprise, has really mitigated that. Is ARP more than COVID response? ARP is more expansive than just COVID. This is to build upon creative policies and practices your program may have started in response to COVID and building workforce resilience. And again, a key part of ARP is trying to keep services available to victims of crime during a global pandemic. So it can be more than just the PPE and testing and things that we've done with previous grants. Next slide. What about hazard pay? Okay, so hazard pay is allowable. However, it must be prorated against all fund sources that fund those positions, federal and non-federal. Agencies must have a hazard pay policy, and all staff are eligible for pay regardless of if they are grant funded. And so here's the key. Your agency has to have a hazard pay policy, and it has to cover kind of everybody. It can't just be, if you're grant funded, you'll receive hazard pay. There has to be policy related conditions that any staff member could meet in order to receive hazard pay. And then once they're eligible, one fund source cannot pay 100% of the hazard pay. It does need to be prorated, just kind of the same way that their salary is prorated across multiple fund sources. If additional guidance is needed on this, we do have a federal site that we can share with some information, and we would be happy to have further conversations about this. But the key things are, you got to have a policy. It can't just apply to grant related people, and it does need to be prorated across kind of all of the areas of pay that would pay that individual. Other question we get is, what if I put something unallowable in my application? Will I not get funded? So the answer is yes, you will still get funded. We strongly encourage you to work with your program manager. There will be an opportunity to correct items that make it into grants that are unallowable, but I just want to recognize for everybody, typically, we allow a 30-day application period. I think this time we did about 45, and so we're going to be really thin on time that we have to go back and forth with agencies. And so if there was just a lot of things in the grant that needed correction, it could potentially affect start dates. So please have those conversations with your program manager beforehand so that we can make sure we get grants as right as possible. But this is not a situation where if you type the wrong words or put the wrong cost in, that where you will not be funded. The letter you received is you will be funded. We just have to work and get the application. Next slide. Any tips for constructing our budgets? This is kind of a summary of some of the things we've talked about. Equipment solely for the use of victims can be in VOCA, does not have to be prorated. Things that clearly tie to COVID-19 or ARP priorities under ARP does not need to be prorated if you put them under ARP. Management expenses can be under FIPSFA and ARP. And I did not want to do this, but I do need to speak to management expenses. I think earlier the slide said board members. Board member cost is not allowable under FIPSFA or ARP. but like executive director salaries and the salaries of other staff who are not overseeing direct services are allowable. Susan Cannon, is that an accurate statement?
Yes, thank you. It is.
Thank you, Susan. Susan has to keep me straight with family violence sometimes. Prevention is not allowable, or sorry, is allowable under STOP, FISFA, and ARP, but it's capped at 5% of the individual award. Again, I recognize this probably won't be a lot of money then that's eligible for prevention under those fund sources. How does an FJC Partners grant impact this application? Okay, so some of the individuals or some of the agencies on this call received an additional letter from us because they work with our state's family justice centers. We are providing to the family justice centers through the agencies that support them a DV and SA advocate that is 100% dedicated to the Family Justice Center and is supposed to be located in the Family Justice Center. Some of you already have these staff members in your current grants. If you got an FJC Partners letter and you have someone in your grant that is 100% of the time dedicated and located at the FJC, you can take that person out of your DV and SA grant and put them into the FJC Partners grant, and that effectively frees up funding for additional items. Next slide. Do we have any guidance for submission? Yes, please send your cost allocation plan. If you're prorating items, I don't foresee a situation where anyone will not be prorating items, so please send your cost allocation plan. You only have to send one packet of supporting documents. So all of these certifications and forms, even though you're writing 3 scopes and many more than 3 budgets, we do not need these forms multiple times. If you'll just include them once, that will be sufficient. Next slide. Do we have any guidance for submission? Yeah, please send the documents in their original format. So for your scopes, we do want the Word forms. For the Excels, we do want the budgets. We cannot contract if those are PDFs. So we will reach out to you about getting these resubmitted. So please help everyone out and just send your scopes and Excel budgets in this format. It also helps long term because we save copies. So when we do amendments, even if there's staff change at your agencies, we'll typically have the copy that we last went to contract with that we can provide. Please send documents as separate files and not as one large PDF. We have to break apart the large PDFs and save the files individually for our audits. And so we do not want one large PDF. Please send them as little individual files. It will really save us hours of time when you aggregate it across multiple agencies. Please send them as separate files. Please don't send us pictures of files. Oftentimes there's an issue with clarity when we get like a camera picture of a file. So we would want, a scanned or PDF document rather than just, kind of holding your camera above and taking a picture of a certification. Please make sure files are correctly oriented. We get a lot of files that are kind of upside down and sideways and then have to go through the PDF editor and rotate them and save them. And, that depending on the size and clarity of the file can take, a few seconds to a minute aggregated across having to do that many times. So please make sure your files are correctly oriented. So when you open, it looks like as if you were reading the document. That would be an extreme help to us. You will have to send one scope and narrative for each fund sources. So this will probably be 3 for most of our DAV agencies and 2 for our SA agencies, and 1 budget for each fund source for each year funded. So this is where we get into like 9 budgets for DV and 6 budgets for SA, and this does not, those numbers do not include the FJC partners. Next slide. Any other funding opportunities available? Yes, as mentioned earlier, transitional housing is posted on our website. Please check and apply. We also anticipate having funding for underserved and elder populations coming later this month. Next slide. Grant process. So your intents and your applications are due on the same date. Again, the intent is how we get your information in the database. That date is April 10th. We are going to do an internal process for reviewing funded approvals. So again, we've already kind of pre-approved everyone for a funding amount. You get to work with your OCJP program manager. We'll have basically 2 people reviewing every grant to make sure there's no unallowables or anything in it, but there will not be an external review team for these. We will contact you with any changes that are needed prior to contract. Again, emphasizing the list of supplemental forms. You only need to send those one time, so you don't need to multiply those. It's just the scopes and the budgets that we need multiples of. Contracts will start 7/1/2022. Send your completed applications to criminaljustice.grants@tn.gov. That's noted in the solicitation, but again, you can work with your program manager directly. That's just how we want to receive all the applications. For more information on reporting, you can visit our website. Then next slide. Awesome. Katie, I know we're low on time, but what questions do we have?
We are low on time. There's quite a few. Some of them we might have to come circle back around with each individual, but I'm going to just run through them all. The first one is, what's the difference between management expenses not allowable under VOCA and supervision expenses that is allowable under VOCA?
So briefly, it would have to do with time supervising a direct service individual. So some agencies, maybe your agency is a smaller one, and so your executive director may do direct supervision of those providing direct services. That time supervising the individual providing the direct services is allowable across multiple fund sources, but administrative work they do that's not fundraising or lobbying, that's also not direct supervision, is allowable under some of our fund sources, and we'll be happy to include that in the FAQ.
For the FJC partner grant, does it mean that staff cannot attend court with their clients if they have to be at the center 100% of the time?
Yeah, let me get back to you with an answer to that question. Some of our agencies have court advocates, but we do recognize the kind of benefit of having someone travel. So let me circle back on that, and we'll get you an answer.
Sure. One program has 2 FJCs that they collaborate with. Can they do one grant application for both, or do they need 2 separate grants, one for each FJC?
We would like one grant for each FJC.
Perfect. Could an agency that does not have an FJC application for funds, or could they apply for funds if, for example, they have a court advocate housed in their county justice center? So they did not receive a letter specifically for the FJC. They're wondering if they could still apply.
So the short answer is no. We have sent letters to everybody except for, I think, the Memphis Family Justice Center, as we've been working to figure out the agencies there. So if you're eligible for an FJC Partners grant and you're not in the Memphis area, you would have already received your letter. Laura, I just want to make sure that's accurate because I know you sent out the last batch.
That is correct.
Okay.
I was waiting on Memphis.
Yes, and the next question is from Memphis, asking pretty much that similar question. So I assume, Sandy, we will be in contact with you outside of this meeting, correct, Jeremiah?
Yes, if that's the agency selected, you'll be receiving a letter probably in the next few days.
Perfect. Just also one intent to apply, even if you're applying for multiple grants. That's we've gone over that. So yes, we just need one intent to apply. The next question is, solicitation says to send an approved cost allocation plan. Would it not actually be the cost allocation plan about the funding streams for this grant cycle since they are changing?
Yes, you're correct.
This is a follow-up to my previous question regarding a agency that does not currently have an FJC application. Could other agencies not with an FJC apply if there are funds unspent for that FJC grant?
I don't have any additional information at this time about unspent funds. We have sent invitations to apply to the eligible agencies. If an agency were to not apply, we would have to have internal conversations about what to do with that funding next.
Great. That was all the questions.
Awesome. I really appreciate everyone hanging on for an extra 5 minutes. I think OCJP staff, we'll remain online for about 5 minutes in case someone's furiously working on typing a question, but I'm going to stop the recording at this time.